everyone! Do you guys ever heard about skin problem? Or maybe do you ever experience with any skin disease before? Whether it yes or no, don't worry because me and my team will guide you guys by sharing and explaining one of common skin problem that I think most of people already experience it, which is acne. Yes, acne! What we will share is all about acne and skin journey. Stay tuned if you want to know a lot of information about our skin and enjoy the sharing! Before we continue to the other part, let me explain first the definition and some facts of acne. Acne is a skin condition characterized by red pimples on the skin, especially on the face due to inflamed or infected sebaceous gland and prevalent chiefly among adolescents. For your information, acne can be formed or starts during teenage, which is 10 to 13 years old. For those who are struggling and facing this problem, they got some issues with their confidence to confront with other people. They might look down instead of looking straight to the face as they feel insecure with others' clear skin. Due to this pandemic, they grab this chance to always put on their mask and feel scared to put it off in front of people. Let me introduce to you guys the type of acne. We got 6 types of acne, which is blackhead, whitehead, pustules, papules, cystic acne, and the last one is fungal acne. Let us start with whitehead and blackhead. Even their name quite similar to each other, they are actually two different things and we will look at it one by one. Firstly, how can it form? For blackhead, it's actually filled with excess oil and dead skin. Meanwhile for whitehead, the pores clogged by bacteria and oil. Blackhead can be formed non-inflammatory acne if it not be treated, and whitehead tend to turn into pimples. For its color, if you guys want to know, an irregular light reflection of the clogged follicle causes the dark spot. That's why we call it a strawberry nose because it looks similar to strawberry seeds on its surface. Meanwhile, the whitehead got white or yellow in color as they have bacteria in it. Last but not least, blackhead live within an open pores, but for whitehead, it closes the opening of pores. So right now, we know both of them are two different things, right?
The causes of whitehead and blackhead is pore on the skin become clogged with dead skin cells, oil or bacteria.
Good morning, sir. How can I help you?
Good morning. Last month, I have bought a facial cleanser brand SS to help with my blackheads and whiteheads and already used it for 2 months. Apparently, it didn't work at all with my skin. Do you know any suitable facial cleanser that can help me regarding my problem?
Oh, I see. Do you know what type of skin do you have?
Yes, I do. I think I have an oily skin. Can you suggest any product that may suitable with me?
Sure. There are 2 products that may be helpful for you. I will explain it briefly later. After that, you can choose which one you want, okay?
I can recommend 2 products that can treat whitehead and blackhead. The products are Salicylic Acid Daily Gentle Cleanser by COSRX and AHA plus BHA Mild Exfoliating Face Wash by Hadalabu. For the first product, it contains 0.5% of salicylic acid. Salicylic acid is well known for reducing acne by exfoliating the skin and keeping pores clear. Salicylic acid is a beta-hydroxy acid types that are oil soluble, which help to penetrate the skin cells at the deepest layer and can remove impurities that clog the pores. It is also suitable for combination to oily skin types. So, how does salicylic acid act to treat whitehead and blackhead? Once salicylic acid inside an open comedome, it will soften the keratin content in that cells that have mixed with sebum to clog the pores. This action helps to lose the blackhead and whitehead by making the sebum easier to remove. Another role for salicylic acid is as desmolating agent, which break the cellular junction or the glue that holds cells together. Disrupting this cohesion between skin cells help to encourage the sloughing of dead skin cells and exfoliation. This removal of dead skin cells can help prevent future clogged pores. Next, I also recommended AHA plus BHA Mild Exfoliating Face Wash by Hadalabu, which is suitable for all skin types. The purpose of both AHA and BHA is to exfoliate the skin. AHA is best for dry skin and surface level skin concern like acne scars, while BHA are best for oily and acne prone skin types. AHA stands for alpha hydroxy acid, which are water soluble. They help peel away the surface of your skin so that new, more evenly pigmented skin cells may generate and take their place. It also loosens the bonds between dead surface layers and the radiant skin beneath. Moreover, their standout hydrating properties and ability to improve visible sign of sun damage make them ideal for normal to dry skin with advanced signs of aging. This product have a double action exfoliating formula which can remove blackhead, dead skin cells, and impurities, while AHA plus BHA will reveal smooth radiant skins. Next, it also can triple the protection which purifies skin and form a protective barrier against a pollutant which reduce the ability to stick to the skin. It also can be gently wash away dirt, excess oils, and impurities without over-drying skin. For the application, salicylic acid cleanser can be applied 2 times a day, which in the morning and night, but is not suitable for all skin types because it can dry out and the skin decrease the sebum production. So, if you are experiencing dryness after using salicylic acid, you may want to consider treatment, especially formulated for dry skin that contains glycolic acid. For sensitive skin, you can still use salicylic acid as part of your skincare routine, but you may want to limit your usage to just once or twice per week. For AHA and BHA mild exfoliating face wash, it is suitable for all skin types, but for the application, it depends on your skin types. If you have oily skin types, you can use it every day, but if you have a sensitive and dry skin types, you only can use it 2 to 3 times a week. To apply it, each product has the same way. First, you need to squeeze a sufficient amount onto your palm and lather it with water. Then, massage into your face with gentle circular motion and rinse thoroughly with lukewarm water. Although salicylic acid cleanser can be applied in the morning and night, you should always be cautious when using an ingredient like this in the day because salicylic acid can make the skin more sensitive to the sun. If your skin is already sensitive to the sun, it is recommended to limit your application to the evening. But if you really need to apply a salicylic acid in the day, be sure to follow it up with plenty of sunscreen. For precaution, remember to not use salicylic acid with any other acid at the same time because extreme skin irritation may occur. Next, you also need to avoid salicylic acid with products that contain niacinamide. Don't use glycolic acid or lactic acid in combination with ascorbic acid such as vitamin C. This will cause the ascorbic acid's benefit to disappear even before it begins to work. Lastly, you also need to avoid using AHA with retinol. So, I hope my explanation about these 2 products can help you to choose what product that's suitable for your skin type.
Let's proceed to the next type of acne, which is pustules. What is pustules? Pustules is a small bump that contains fluid and pus. Because of the presence of the pus, it appears as white bump surrounded by red skin. Other than pustules, we also call it as blemish and zits. This acne can appear anywhere in the body, especially on face, neck, shoulders, and back. Pustules can occur among the teenagers who are undergoing hormonal changes, especially for those who just starting their menstruation cycle.
The causes of pustule acne are clogged pore, allergic reaction to food, environmental allergens, bacteria, and excess oil production. The causes of papules acne are bacteria, excess oil production, medication, emotional stress, excess activity of androgens, and unhealthy food habits.
Doctor, I think I have papules acne. Can you recommend any products for me?
Miss, I think you have mistaken your acne between papules and pustules. Based on the appearance of your acne, it seems like you have pustules.
Pustules? I have never heard of pustules before. I really thought that I have papules acne. What can I do?
Don't worry, miss. Patients are often unable to distinguish between papules and pustules. I'll explain truly later. Before that, may I know what type of skin do you have?
I have an oily skin type. Also, what kind of product should I use to treat my pustules?
It is normal if people are mistaken between papules and pustules since they look quite similar. But don't worry, I'm going to explain in detail to you about the differences between papules and pustule and the example of product that can be used to relieve it. Papules are a type of inflammatory acne that originates in the epidermis, which is the outer layer of the skin. A papule is a raised area of skin tissue. It can appear in a variety of shapes, colors, and sizes. In most cases, pimples are not serious. Now what about pustules? It is also an inflammatory pimple found in the epidermis. A pustule is essentially a papule that's come with a head from a white or yellowish point of pus at the center. They usually appear as white bumps surrounded by red skin. These bumps look very similar to pimples, but they can grow quite big. And how do you differentiate between papules and pustules? Papules are usually just some raised bumps on the skin, but pustules are raised bumps with a white yellowish center. So based on your case, it is clear that you have pustules. Since you told me that you have oily skin type, now I'm going to suggest to you a product that can relieve this kind of acne that is suitable for your skin. For pustules, it is recommended that you use Epiduo gel. It is a white to very pale yellow opaque gel. This medication is well known in treating acne. The active pharmaceutical ingredient inside the gel are adapalene 0.1% and benzoyl peroxide 2.5%, which work through different but in complementary ways. If you are new to adapalene and benzoyl peroxide, let me explain to you how they work in treating your pustules. Adapalene is a synthetic naphthic acid derivative with retinide activity. It is an anti-acne and a cell-communicating ingredient that signals to our skin cells to behave better. Anti-acne is usually a nice ingredient that helps you to fight against acne. They are also often antibacterial or anti-inflammatory agents. It may decrease the number and severity of acne pimples and promote quick healing of pimples that do develop. It works by affecting the growth of cells and decreasing swelling and inflammation. Besides adapalene, Epiduo gel also contains benzoyl peroxide 2.5%. Benzoyl peroxide is an antimicrobial, which means it helps in reducing the number of acne-causing bacteria on the skin. Less bacteria leads to less breakout. Benzoyl peroxide also helps in keeping the pores clear from blockage. It is the most effective over-the-counter acne treatment available. Once absorbed into the skin, benzoyl peroxide is converted into benzoic acid. This benzoic acid interacts with cysteine, which is the amino acid, to release oxygen, which kills harmful bacteria. Another factor that makes this treatment so effective is its ability to help rid the follicle of excess dead skin cells. Clearing the pore of cellular debris will lessen the chance of pore blockage or comedons. So, benzoyl peroxide helps prevent breakout before they start. Because you have an oily skin type, so this product is very suitable for you since it comes in gel form. Before you apply this Epiduo gel, make sure to cleanse your skin with a mild or non-soap cleanser. After that, allow your skin to dry for a while. Apply a thin film of gel evenly over the entire acne-affected area on your face. You should apply this gel once a day on a clean and dry skin. Do not rub your skin while applying the gel. Also, take care to avoid getting it in your eyes, on your lips, on the wings of your nose, mucous membranes, wounds, or skin affected by eczema. If you accidentally get it in your eyes, immediately rinse your eyes with water, and you should wash your hands after using the medication. There are a few precautions that you need to know before using this gel. During the first few weeks of using adapalene, your acne might appear worse because the medication is working on pimples forming inside the skin. Do not use a large amount or use it more frequently than recommended, since it will not improve your skin any faster, and it will increase the risk of developing redness, peeling, and pain. Since this medication may make you more sensitive to the sun, use sunscreen and wear protective clothing when outdoors. Avoid electrolysis, waxing, and chemical depilatories for hair removal on this treated area while using this product. Skin redness, dryness, peeling, mild burning, swelling, or worsening of acne might occur during the first 4 weeks of using this product.
This effect usually decreases with continued use. You should remember not to use any product that contain other drugs that may increase your sensitivity to sunlight, such as tetracyclines, hydrochlorothiazide, and other acne skin treatments such as tretinoin and dapsone, since this drug absorb through the skin and may harm an unborn baby. Women who are pregnant or who may become pregnant should not handle this medication. For the storage, you should keep epidural in a cool, dry place where the temperature stays between 30 degrees Celsius. Do not refrigerate or store it in a bathroom or near a sink. You should not leave epidural in the car or on windowsills, because heat and dampness can destroy some medicines. You also need to keep epidural where children cannot reach it. A log cupboard at least 1.5 meters above the ground is a good place to store medicines. And lastly, do not use epidural after the expiry date which is stated on the pack. That's all for now. So if you have any question, feel free to contact me.
We move on to the next type of acne, which is cystic acne. Cystic acne is a type of inflammatory acne that causes painful. It forms pus-filled pimples deep under the skin. How you want to know when you suffer from cystic acne? You guys can figure it out when the acne that you got is large, red, and painful breakout deep in your skin. Pimples starts when a pore in your skin gets clogged, usually with dead skin cells. Bacteria can also get trapped, causing the area to become red and swollen. Cystic acne happens when this infection goes deep into your skin, creating a bump that's full of pus. It may hurt or itch. If a cyst bursts, the infection can be spread, causing more breakouts. Moreover, cystic acne often looks like balls on the skin. Other identifying characteristics include large white bump as the presence of the pus, redness, and tender or painful to the touch.
The causes of cystic acne are trappage of skin cells, bacteria, excess oil production, and hormonal imbalance.
Hi doctor, I'm the one who contacted you through WhatsApp about my acne condition 2 days ago.
Yes, I remember it. So how was your acne? Is it become worse or have any improvement?
Not really. It's just the same, but it is painful and tender when touched. It feels like the acne underneath my skin and do not have head.
Based on what you said, I think you have cystic acne. Let me have a closer look at your face. Yes, you have cystic acne, and it cannot be treated with over-the-counter acne product.
Oh seriously? I don't know that I have cystic acne. If that's so, what product that I can use to treat my acne? Can it be treated?
Yes, it can be treated. I will prescribe you with a medication called as Rating A. Don't worry, I will give you explanation about this product and how to use it.
I will explain in detail what Rating A product is and how to use it. Rating A is a brand of retinoid medication. Retinoid is part class of medication known as retinoid, which is a skincare medication that derived from vitamin A. You must be wondering, how does retinoid act to treat cystic acne? When applied to the skin as a topical treatment, retinoid will reduce the inflammation by alkaline the pores and pierce the affected skin. It also will increase the collagen production and break up melanin granule in the skin. As a result, it can act as prevention against the formation of new acne, reduction of acne scar, and smooth the skin. Besides that, it also can minimization the fine lines and wrinkles and lightening of hyperpigmentation. Rating A product comes in two types of form, which is in a gel and a cream form. What is the difference between a Rating A gel and a cream? Main difference between retinol gel and a cream is the ingredient used in the product and the effect of those ingredients on the skin dryness and irritation. For Rating A gel, it contains a butylated hydroxytoluene, hydroxypropylcellulose, alcohol, and active ingredient retinol. While in other hand, Rating A cream contains a stearic acid, isopropyl myristate, polyoxyphosphate, stearic alcohol, xanthan gum, sorbic acid, butylated hydroxytoluene, sulfate water, and active ingredient retinol. So, what is the effect of those ingredients in each product? For the gel, The ingredient was significantly more effective at reducing the facial shine than the cream application after applying for 3 to 6 hours. While for the cream type, if you struggle with your dry skin, the moisturizing effect of the sterile alcohol in the cream 13 formulation might prove to be a better choice for your skin. Do you have any question?
So, if I have a dry skin, is it better for me to use a cream type?
Yes, it's true. It's better for a dry skin to use a cream type.
How do I apply this cream on the acne spot? Do I need to wash my face first before applying the cream?
The way to use the product is the same for a gel and a cream type. Firstly, it's really important for you to wash your face first with a mild soap to cleanse your skin. Then apply enough, like a pea-sized amount to the entire affected area once daily at night or before bedtime. Set a timer for 20 minutes and avoid touching your face or applying any other skincare products until retinol have been fully absorbed. If you have a dry, flaky or peeling skin, you can apply alcohol-free moisturizer after 20 minutes have passed. Therapeutic effect may be observed after 2 until 3 weeks, but it may require more than 6 weeks of treatment to see the consistent beneficial effect. However, it is important for you to know that when using a retinoid, it will make your skin become dryness and irritation due to effect of sebum, an oily substance naturally produced by our skin. So, properly moisturize your face when using a retinoid. As a precaution, it is not recommended for individuals with skin allergies or those who routinely experience acne and inflammation. Retinoid also can make the skin more sensitive to sun exposure, so try to avoid or minimize exposure to sunlight, including sunlamps. If exposure cannot be avoided, use a sun cream or protective clothing over the treated area. While for someone that have a sunburned skin, it's better to not apply retinoid until your skin have fully recovered. You will also want to ease out on the use of products that contain sulfur, resinisol, and salicylic acid, as the combination can cause the further skin irritation. That's all you need to know when using a retinoid. Do you have any questions?
Can I put the product in refrigerator, like to have a cold effect when applying it?
Oh, you don't need to. Just put the product in the room temperature and do not freeze it. Any other question?
No, I think I have fully understand of what you are trying to explain.
Okay, good. I hope my explanation will help you to use the product.
Finally, we are at the last type of acne, which is fungal acne. What is fungal acne? Okay, fungal acne, as we can see in the picture, it appears as a small pimple in large quantity. You guys need to do a bit revision or meet at the doctor to make sure you really got fungal acne and what's the best product for you to use. This is because if you guys use anti-acne product, it will make the fungal acne become worse as it is not the bacteria who infected the skin. It commonly shows up on forehead, chest and back. Sometimes it causes itchiness on the area. We can know it is a fungal acne when it tends to be all in the same size. Other than that, we can see all of those appear in clusters of small whitehead.
The causes of fungal acne are overgrowth of yeast, trapped moisture, medication, diet changes, wearing tight clothes, suppressed immune system, and warm or moist environment.
Hello, good evening. May I help you?
Oh, I want to ask you about these tiny bumps on my face and arm. Do you know what it is?
Let me take a look. Oh, looks like you are having fungal acne.
Fungal acne? What is that? Can you explain more and suggest any products to get rid of them?
Based on your condition, you have fungal acne. I will explain to you about fungal acne. Fungal acne is a type of infection in your skin hair follicle. It most commonly appears as small pimples that don't vary much in shape or size, and it often comes along with itching. Fungal acne isn't caused primarily by oil and bacteria in pores. Instead, the pimple-like bumps and irritated skin associated with fungal acne are caused by an overgrowth of yeast, which is a type of fungus. The yeast responsible for fungal acne is always present on our skin. Typically, our body are able to balance the yeast, other fungi and bacteria that are also part of your skin. If that natural balance is upset, an overgrowth can occur. People usually mistaken bacterial acne with fungal acne. Not knowing the difference between these two acne, people may treat it with regular acne skincare option. This treatment don't work and they can make the infection worse. Here's how to tell the difference between fungal acne and bacterial acne. First, you can tell the difference from size. Pus filled bumps caused by fungal acne tend to be nearly all the same size, while bacterial acne can cause pimples and whitehead with varying size. Second, you can differentiate it with the location. Fungal acne often shows up on the arms, chest, back, and forehead. It can also be on the face, where bacterial acne is most common. And third, itching. Fungal acne often cause itches, but bacterial acne don't. So, how to treat this fungal acne? My suggestion product to treat this acne is by using Nixodium ointment. I will tell you more about this product. Nixodium ointment is a foam ointment that adheres to the skin, and its formulation will keep its active ingredient in contact with the skin for an extended period. It also can help to relieve acne and common skin problems. Nixodium ointment works by suppressing the ability of fungi to grow or reproduce by altering their structure, absorbing the sun ultraviolet radiation, works on reducing swelling, redness, pimples, and also loosen and soften the dry skin and scaly skin. How this ointment helps to treat fungal acne? Nixodium ointment contains benzoic acid, salicylic acid, and sulfur. Benzoic acid in this ointment provides good antifungal properties, while salicylic acid is a keratolytic agent which treats and prevents acne from appearing on our skin. Sulfur in this ointment is a mild antiseptic, antifungal, and parasiticidal agent and very useful to prevent excessive growth of fungal on our skin. So, how to use it? First, you need to clean your face thoroughly and then apply a large quantity of Nixodium ointment on the affected region, massaging it gently and completely. It's the best to do it twice a day, in the morning and evening. The therapy should follow for 7 days, then stop for 3 days and before starting again for another 7 days. Continue to treat in this manner until the problem is resolved. Make sure to wash your hands before and after using Nixodium ointment. Redness, skin irritation, burning, and itching are the common side effects that might occur when you use this product, but the effects doesn't last long. Skin irritation and dryness is more likely to occur if you use another topical acne medication at the same time. If irritation occurs, only use one topical acne medication at one time. If any abnormal dryness, irritation, excessive burning, stinging, or peeling occurs, please discontinue the use of the product.
With all the information given, we hope that you will have better understanding about acne. Hence, before we end our video presentation, let us give you some tips about how to prevent acne for better skin. The first one is properly wash your face to remove excess oil, dirt, and sweat. Next, know your skin type, whether you have oily, dry, or combination skin. Also, keep your skin moist. Make sure to use moisturizer after wash your face. Besides, you have to drink at least 8 glasses of water daily to stay hydrated. The most important is, do not forget to use your sunscreen. Sunscreen helps to protect your skin from harmful sun exposure. Not only that, but you have to avoid certain foods that can trigger acne. For example, refined sugar and fast food. Then, limit your makeup. This is because doing so may clog pores and trigger outbreaks. Be sure to gently wash any makeup off when you're done wearing it, especially before you go to sleep at night. After that, avoid touching your face. I know it's hard, but think about all those places your hands have been during the day. Do stress-busting activities such as exercise and yoga. This is because stress can trigger acne too. Next, change your pillowcase weekly to avoid from bacteria, dead skin, and dirt gathered around your skin while sleeping. Aha! Do not ever pop up your pimple. You may get skin infection and scars by doing so. Last but not least, make sure to get enough sleep of 7 to 8 hours. That's all from us. Thank you for watching our video. Goodbye.